Hi, I'm Jason Chiang from the University of Melbourne, Australia. I work in the Department of General Practice as a PhD student. My research is in multi-morbidity in people with type 2 diabetes. I'm looking at its effects on different outcomes, particularly mortality and different measures of glycemia in people with diabetes. It's been a great opportunity to come to NAPCRG to showcase my works from my PhD, and I'm humbled to receive this first place award for the most distinguished trainee presentation. I have the opportunity to work with international collaborators from the University of Glasgow, including Francis Mayer, Bhutesh Jani and Barbara Nicole, and also this year I've had the opportunity to visit them and experience academic life in a different setting in Glasgow.
Hello, my name's Oghenekome Gbinigie and I'm at NAPCRG. Well, I've presented a systematic review that was looking at clinical predictors of pneumonia in older adults in the community. We have a growing population of older adults. They're more susceptible to getting infections like pneumonia, but when they get them, they're more likely to present atypically. And there hasn't been huge amounts of research done to look at these sort of atypical presentations. So I was interested in sort of going into the literature to find out what are the symptoms and signs that can help us to make a diagnosis of pneumonia in older adults in the community. So generally speaking, the traditional ones that we're taught about are cough, bringing up a mucky sputum, having chest pain, shortness of breath, and probably having a fever too, and an increased respiratory rate. Part of my inspiration to do with the review is that some of the patients I find most difficult to manage in general practice are older adults who are fairly non-specifically unwell, and then sometimes you find that they end up having a diagnosis of pneumonia, and so it can be quite hard to know what really tells you if they do or don't have pneumonia. So I wasn't sure what we would find in this review, whether those traditional symptoms and signs would be shown in the literature to be diagnostic or not. But it turns out that a lot of them, from what we found anyway, a lot of those symptoms and signs weren't particularly helpful in making the diagnosis.
So we wanted to look at healthcare associated transmission of influenza, because it's something hospitals look at, but it's not really a topic in primary care, whereas most of the influenza patients actually go to primary care. And so we wanted to see if the people working in primary care get influenza and how much, and so we set up a study to do prospective surveillance of influenza in primary care health workers. And this was just a pilot study where we looked whether it was feasible or not, and it worked out pretty well. So people received an email with a questionnaire, as is done in other population-based studies, and they're asked whether they have influenza-like illness or not, or symptoms of EELE or not. And if they do, they're asked to do a swab. And we found that it was feasible to do so, that once people started to answer to the survey, they continued to do it all over the season, and that they could also do a swab.